Last night I was talking to a friend, and about 2 years ago, she asked me if I was going to do any cosmetic surgery, what would give me the most bang for my buck? And I said, your eyes. Eyelid surgery is according to the data, it's the fifth most popular procedure. And it's one of those, I think, well, I want your thoughts. Why do you think that it's so popular and that people love it so much?
I think that eyelid surgery is a nice pick me up. When we look at people, when we make contact, so much of our relationships, we're looking at people's eyes. And as we age, our eyes tend to look smaller. They tend to look a little less bright. They get shadowed and they look tired. And nobody likes to feel like they look tired. Everybody likes to feel like they're exuding the energy that they have. And when your eyes just start getting a little heavier, you don't present yourself with that same sort of energy that you may be feeling inside. I think that when people are seeing themselves in pictures, they feel like they lose their eyes when they're smiling before surgery and they feel like they see them afterwards. And I just think that the recovery is really quite manageable. Most people are back to work after a week's time. And so it doesn't knock them down very much. So it really just puts a lot of pep in people's step again.
What are the most common reasons that people complain about their eyes and show up asking for eyelid surgery?
A lot of people, it's interesting, don't equate the puffiness under their eyes as eyelids. They'll often say, my eyelids are just the upper, and then what do we do about the bags under my eyes, which are actually the lower eyelids and a lower eyelid lift. But those are the two things, heaviness of the skin around or overhanging sort of their eyelashes where their makeup is getting smeared or they feel like they just don't see their eyes as well as they used to when they smile, and then the puffiness under their eyes making them look heavy or tired.
What actually causes your eyes to look like that over time?
Well, the skin on the eyelids is pretty thin, and we lose elasticity in our skin everywhere. And when you're already starting with a very, very thin layer of skin, you lose some elasticity and you see it more. I think we blink something like 17,000 times a day. And so just that action sort of wears things out a little bit. And then just there's a lot of animation around the eyes. When we smile, when we close our eyes tight, if we sneeze, whatever, there's just a lot of movement around our eyes. And that also wrinkles and crinkles the skin. And all of those things create lines and then there's, sun damage and all of these things also sort of add to the aging of the eyes. And that's true for the skin. As far as the lower eyelids, there is a septum that kind of holds the fat in place because there's actually a lot of fat around our eyes. It pads them so they can kind of glide and the muscles can kind of glide. But when that septum on the lower eyelid, and sometimes in an area right by the nose on the upper eyelid, those septums can get a little weak. And sometimes they even have little gaps or kind of spaces where the fat can bulge forward. And when that happens, it pushes everything forward and creates shadows under your eyes. Looks that heaviness there.
Is there a certain age where this starts to happen pretty much to everybody?
I think pretty consistently by our 40s, everybody's noticing a little bit of change. There are some folks, even some children, that will have that little puffy pocket of fat under their eyelids, even as children. And so sometimes people will come in their earlier years, 20s, 30s, and ask about it. Sometimes it's rare that somebody in their 20s is truly ready for eyelid surgery. But every now and then there's somebody who may have that sort of more congenital bulging of that fat pocket or a little herniation of that fat pocket. But otherwise, 40s and beyond is what's most common.
Are there people for whom their eyelids can actually interfere with their vision and get in the way?
Yeah, eventually the upper eyelid skin, if it gets heavy enough, if it hangs down low enough, it can start to block some of the vision, the peripheral vision. We talk about visual field obstruction. And so it's kind of like when you see horses in Central Park or whatever with the blinders on, that starts to happen and people can't see out the corners of their eyes as well, which can affect with driving or in Portland, bike riding, etc. And so
You got to be able to ride your bike.
You got to be able to ride your bike and see those cars. Yeah, so that's where we start seeing visual field. It also is fatiguing, and people, their eyes will be tired by the end of the day, and they have a hard time getting through their day of work or what have you before they start getting, their eyes just get kind of worn out because those little thin muscles are trying to hold a lot of extra skin, do a lot of extra work.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.